The first new adult cystic fibrosis service in the UK for 40 years has been launched by Blackpool Teaching Hospitals NHS Foundation Trust. This prestigious new service is fantastic news for adults living with cystic fibrosis in Lancashire, Cumbria and other parts of England. Patients with cystic fibrosis now have access to a highly skilled, multidisciplinary team based at Blackpool Victoria Hospital.
Thank you all for coming for the opening of the new Blackpool Adult Cystic Fibrosis Service. Yes. Everyone's come, which is fantastic. Even Emily's come all the way from Florida, which is amazing, to show us her gold medal. So, I've been working in this trust for nearly 11 years now. About 9 years ago, I was sitting in a business meeting with my colleagues. A letter arrived on our desk. The letter came from specialist commissioners. It said, we are considering setting up a new adult cystic fibrosis service in the northwest region. We looked at that letter and we thought to ourselves, could it possibly come to Blackpool? Is Blackpool the kind of place that gets a service like that? And we thought, yes, it is the kind of place. It's only taken 9 years. And here we are 9 years later, 9 years of hard work with our brand new service, with the support of our colleagues at UHSM. Fantastic support of our colleagues at UHSM, I should say. Well, we thought about who should open the service. We thought to ourselves, who better than Prof Webb, for a number of reasons. Prof Webb is a famous name in the cystic fibrosis world, as many of you will know. He's also an old friend. He trained myself, he trained Professor Jones, he trained many of us in this area here. We have huge respect for him. He's also a very experienced man at cutting ribbons, so I've been told. So it was an easy decision to ask Prof to come along and cut the ribbon for us. Now, Roland's given me a whole list of your achievements here, Prof, which I was going to read out, but I'm not going to, because I think it all speaks for itself.
Some of them aren't achievements.
Except to say how proud we are to have worked with you, how great you've been at training all of us and supporting us to set up this new service. Thank you very much. So I'll leave it over to you now to cut the ribbon and see what's behind these curtains.
Thank you, Tarek. I haven't been practicing, but it's going to be good. Yeah. I can never leave a meeting without saying anything, and this is a most welcome opportunity. Thank you for asking me to open and launch the Blackpool Adult CF unit. For various reasons, which I'll clarify, this really is an auspicious and most welcome occasion, particularly for the future of adults with cystic fibrosis. I think Tarek hinted at it, really. This is the end of a very long-travelled road, probably over 10 years, and it's a fulfilment of a dream, really, turning truly into a reality. We've had very many frustrating teams at times, but that's true as well. But eventually Blackpool, correctly and for the future, has won the beauty contest. I'll tell you why this is important. The future for adults with cystic fibrosis has really changed beyond all recognition that some of you won't recognise. Mary Dodd and I started in 1982 in a small Nissen hut in the third world of North Manchester, a small cystic fibrosis unit. And those were terrible, terrible years. I call them the years of carnage because we probably had about 15 to 20 adults dying a year out of our 120 patients, and I'm not quite sure how we did it. And yet, further on, 30 years on, the median survival, and I'm not talking about dying, the median survival of people with cystic fibrosis, because they're not patients, in the UK is 47 years old. And they are in their 50s and their 60s, which was beyond dreams. And it is far beyond, in survival terms, any other disease status that you know of. There's nothing which compares to cystic fibrosis in terms of decade by decade survival. There simply isn't. And the patients now, which did not used to be the case, are older than the staff, which is really rather odd in the way we started out all those long years ago. And furthermore, that survival has been based upon centred care, exactly what Blackpool is going to be. A door has opened, and Blackpool is going to be in receipt of this. A door has opened, gene therapy failed miserably, and that doesn't matter, because a door has opened now only over the last 3 years, with drugs which are gene transforming. It's not gene therapy. And that's going to open up and open doors, again, which we never thought. So the future for people with cystic fibrosis is really fantastic. And yet, despite what we call an adult epidemic survival, Blackpool will be the first new adult CF unit to be established in the UK for 4 decades. And that again, is a first, and it's quite an intimidating first for you. I don't have any doubt your future is going to be very successful, and you will be the benchmark and the template for other nascent units in the UK. And I can assure you, you will be watched very carefully, and I have no problems it's going to be hugely successful. I'm well aware, as we all are here, and that's why we're here together, this has been a joint enterprise between the medical and managerial teams of UHSM and Blackpool. And I know a considerable amount of work has gone in to providing the architecture of this unit will last a long time for the future. You should be very proud of this. Congratulations. Today's a wonderful day for Blackpool, and it's a wonderful day for adult CF. Thank you. Do you want me to cut it?
No.
A word from the Trust Chairman, Mr. Johnson.
Hello, nice to see you, and thanks so much for coming today. Thank you for everyone for coming. If this is a sign of how successful the unit's going to be, then it's got off to a great start and the sun's shining. Now, I'd just first of all like to thank you for coming here today and for all your guidance and help, which I've heard about, and also for your colleagues in Manchester, because this seems to be a really good example of which, sadly, there are far too few, of cross-border working in the NHS. Working for the benefit of the patients and the people who use this service. So that's really good. And I'm sure in time that those, if we don't have to wait another 40 years for another centre to open, Blackpool colleagues will be helping someone else in the future to do the same thing. I mean, I did think it was due to the enthusiasm, hard work, dedication of Tarek and his team that we got this service. So thank you so much everyone for being here. I think the team know what the challenges are. They came and talked to the board last week about them. In fact, they wowed the board. We ended up, as enthusiastic, I think, as they were. And we all know the hurdles that you still have to cross. But I think this is going to be something that not only improves lives, actually could change lives in lots of cases. So thanks again. Thanks to all the team.
Cystic fibrosis is a genetic disorder that mainly affects the lungs, but also the pancreas, liver, kidneys and intestine. Long-term issues include difficulty breathing and coughing up mucus as a result of frequent lung infections.
I've looked after children with cystic fibrosis for about 20 years now, and I've seen many of them go through the transition process into adult care. However, usually they just go away to Manchester to Withenshaw Hospital, where they get excellent care, but it's a long way for them to travel. I'm delighted and proud to be involved with the setting up of a new adult CF service. I've seen some of my own patients come through the transition process into our adult service, and I'm very pleased to say that they seem happy with the way things have gone, and I'm happy that we've been able to look after them as a child and also as an adult.
Really pleased to be here today for the opening of our Cystic Fibrosis service. It's a fantastic achievement for the Trust. It's a great asset now for Lancashire and South Cumbria. It means that our adults with Cystic Fibrosis won't have to go to South Manchester, they won't have to go to Blackpool for treatment. It will attract people to come and work in Blackpool, and and it's a big thank you to Dr. Sabat and all his team and Dr. Rowlands for everything they've done to make this feasible and possible to do.
So it's been a really exciting day. Here we are at last, the new Blackpool service has opened, and I saw this day coming, but I didn't know when it was going to come. I always remember 9 years ago reading that letter that arrived on our desk saying, you know, here's a chance to run an adult cystic fibrosis service in Blackpool, and I thought, we can do this. I picked up the phone to you, Andrew, I think, and to Prof Webb, and started the conversation. And here we are 9 years later with 3 consultants and a close working relationship with the UH Centre. One thing I should say is thank you very much for your training and support. It's been an amazing few years in terms of the hurdle we've had to jump through, the obstacles that came in our way, and all the training we've done as well on your team. You've always supported us right from day one and given us all your time. And also you've trusted us also with your patients, you've trusted us with your resources and your time. It's fantastic. We really appreciate that.
So after a decade of planning, this is really successful. It is a really successful launch. What we really wanted was an enthusiastic team created at the hospital and enthusiasm from that hospital. Blackpool have been enthusiastic about this project from the very beginning. I think we've been very lucky in terms of the personnel that we've got and a close relationship. We've all developed as CF and CF teams to develop the centre and then today to officially launch it.
Absolutely delighted to be here today at the opening of this wonderful new unit. It's been a glorious event, opened by Professor Webb. Been absolutely fantastic to meet a patient with cystic fibrosis who's going to benefit from this new local centre, no longer having to travel long distances for outpatient and inpatient appointments. The Cystic Fibrosis Trust itself has been involved from the beginning really with the opening of this new unit. We peer reviewed with Ensure about 3 years ago probably and recognised that they were at full capacity and we wanted to put our full support behind this new unit for the people of Blackpool and the region. We also provided funding for the training of 2 consultants and we'd be delighted to do so. So thank you very much for inviting us along today. The Cystic Fibrosis Trust supports the new Blackpool Adult CF Unit.